I'm Christie Herrera, and thank you. Senior Fellow at the Foundation for Government Accountability. FGA is a health and welfare-focused think tank, and we work in all 50 states. And what we do is we work with state officials on health insurance reform, Medicaid reform, and child welfare reform. Ellen tasked me with talking about Obamacare and particularly Medicaid expansion. And unfortunately, this could be like an 8-hour session, but I only have about 20 minutes. And I was trying to think about how do you wrap in Medicaid expansion with the rest of Obamacare. You know, it's a 2,700-page bill. I often chuckle when I see that H&R Block commercial with that employee who brags that she's read the entire thing. It's like, really, lady, you did? You know, not many of us have that kind of time. So I was trying to think about Obamacare, and you can really think about it like a three-legged stool. On the first leg, you have mandates, right? So those are the mandates that require ordinary people and businesses to buy government-defined health insurance or else pay a penalty. There are so many questions about the mandates. You know, will enough young people buy health insurance coverage to make it cheaper for all of us? Will the president give individuals the same one-year delay that he gave businesses on the mandate? The second leg of the stool are the health insurance exchanges. So those are the new entities that are designed to both regulate and subsidize the purchase of health insurance. Of course, the exchanges are tied to the healthcare.gov website. So if you watch Jay Leno or Conan O'Brien, you hear a lot about healthcare.gov. In fact, we were at dinner last night and someone said, Christy, did you know that there are a lot of fraudulent websites cropping up around Obamacare? And I said, really? How do you know which ones are fraudulent and which one's the actual thing? And he said, Christy, the fraudulent websites are the ones that work. So with that, so we have mandates, we have the exchanges, and what I'm here to talk about today is the Medicaid expansion. So for those non-health nerds that are in the audience, Medicaid is a government-run healthcare program that serves low-income parents and children, some folks on Medicare, as well as the disabled. Today, about 228,000 South Carolinians on Medicaid today, and depending on who you talk to, the expansion could bring about 330,000 plus more people onto the program. So how do we know who qualifies for Medicaid? Here are the major categories of Medicaid coverage. The federal government defines the word poverty by how much money you make, and that's called the Federal Poverty Level, or FPL. Here in South Carolina and in the lower 48, the federal poverty level is about $12,000 for an individual and about $23,000 for a family of four. So you can see that before any Medicaid expansion even takes place, Medicaid already covers kids, parents, and the disabled, and in some of those cases, they can earn up to 2 times the federal poverty level and still get coverage. So I mentioned that Obamacare is like a three-legged stool, and the reason why I think it's a three-legged stool is because the pieces are all designed to kind of work together, and Medicaid and the health insurance exchanges are no different. Here are all of the populations that Obamacare tries to cover. The light blue bar on the bottom shows what you need to earn in order to qualify for Medicaid coverage, and the dark blue bar at the top means that's how much you have to earn in order to get health insurance subsidies within the exchanges. We talk about Medicaid expansion, many folks say there's a gap population, and those are the small areas in white. What is the gap population? That means you're talking about people who make too much to qualify for Medicaid, but not enough to qualify for those subsidies in the exchanges. As you can see, when you talk about Medicaid expansion in South Carolina, there really aren't many gap populations when you talk about the traditional Medicaid recipient. You have a small gap with low-income parents making between 63 and 99% of the federal poverty level, and that's where Medicaid expansion is. But you can see that even before expansion, Medicaid covers kids, pregnant women, and the working disabled even more than what Obamacare requires. And when you see that dark blue bar fall below the red line, that means that South Carolina will be on the hook to pay for Medicaid for these folks when they could have gotten subsidies on the exchange. So when we talk about Medicaid expansion, who are the group that we're really talking about? The group that we're really talking about are non-disabled adults without children. As you know, there was a big Supreme Court decision last year, and one of the outcomes of that was that states now have the option to expand Medicaid up to 138% of the federal poverty level. Here is where we are today. So you can kind of read this map like a stoplight. Green means go toward expansion, and red means stop. 26 states, those are the states in green, have now accepted the Medicaid expansion or are leaning that way. 24 states, including South Carolina, have rejected the Medicaid expansion. And it's been interesting because you probably have seen a lot of publicity around Republican governors who have decided to expand Medicaid. You know, Ms. Scorpions for breakfast, Jan Brewer out in Arizona decided to expand Medicaid, and John Kasich said he was on a mission from God. I didn't know God had Medicaid policy, but apparently he does, and he said that John Kasich had to expand Medicaid. But what we're also seeing is that a number of red states are also standing firm. Last week, Alaska Governor Sean Parnell rejected the Medicaid expansion. He called it, quote, a hot mess. And just last night at 5 o'clock, the New Hampshire special session on Medicaid expansion concluded without any expansion at all. So with that in mind, I want to cover kind of 3 topics for Medicaid expansion. 1, how much is it going to cost? 2, how will it affect the healthcare system in general? And 3, what has been the experience of other states who have tried to expand Medicaid even prior to Obamacare's passage? So let's talk about cost. It's late November, and during this time of year, I'm doing my Christmas list, and I'm sure you guys are too. So imagine that you had $200 to spend on Christmas gifts, but you don't know how many people to buy gifts for, and when you walk into the store, all of the price tags are blank. Right? That's the situation that we're in with Medicaid expansion. We don't know how many people will sign up for the program. Studies estimate as few as 73% of the uninsured and as many as 95% of the uninsured will enroll. We don't know how much the Medicaid program will grow. I looked at the Milliman report issued for South Carolina, and they predict that Medicaid spending will grow between 3 and 4.5%. But when you look at historical Medicaid spending growth over the last 15 years, it has grown twice as fast than that. Third, many folks claim that this Medicaid expansion is going to be relatively inexpensive. After all, we have all these free federal dollars, and we'll just fleece the federal taxpayers, and they'll pay for it, and we'll have the free Medicaid expansion. That's part of the issue. But the other part of the issue is that folks say that the childless adults who are not disabled coming into the program are going to be cheaper to cover than they actually are. The Milliman report in South Carolina, again, claims that low-income parents currently on the program and the expansion population coming into the program will cost the same. But the federal government's own data, Kathleen Sebelius commissioned a study, that data suggests that the childless adults coming into Medicaid on expansion will cost 60% more than low-income parents currently in the program. These folks are older, they're more likely to include men, sorry guys, and they're also more likely to become Medicaid eligible due to a disability. So they're not disabled enough to be on Medicaid today, but they do have health problems. Here's a picture of, I live in the Washington, D.C. area. Here's a picture of 2 guys that are pretty powerful in Washington. What do you think they have in common? Any answers? Well, the answer is that both of these guys have pledged to cut Medicaid expansion funding to the states. So in President Obama's last 3 budgets, he has proposed shifting more Medicaid cost onto states. In 2 of those budgets, he proposed what's called a blended rate. And the blended rate goes back on that promise of a free Medicaid expansion. What the blended rate is an average of the Medicaid money you get today and the money that Obamacare promises you. And of course, Paul Ryan gets up every day and thinks about Obamacare, and in his budgets, he eliminates all Obamacare spending, including funding for Medicaid expansion. So remember this point the next time someone tells you this is going to be free. especially when both parties would suggest otherwise. The second question, how will it impact our healthcare system? And in other words, what does it mean to put 333,000 plus more people onto the Medicaid program? Well, Tony had a great map up there, and the national data really supports that. In general, we know that people on Medicaid have more difficulty accessing a primary care doctor, specialty care. In fact, the federal government's own data suggests that people on Medicaid are twice as likely as the uninsured and 4 times as likely as the privately insured to use the emergency room. So we've all been to the emergency room with a sick child or a sick parent. So consider that the next time that you go to the ER, the people that you see around you are probably not all uninsured. They're probably mostly Medicaid patients who can't get in to see a doctor. Finally, we don't know if Medicaid leads to better health. I actually took pictures on my iPhone of your slides because I think that study that you talked about at the beginning was so important. We do have one major study from the state of Oregon. Oregon expanded Medicaid via lottery. So you put your little raffle ticket in and they decided, okay, you get Medicaid and you don't. And what that allowed them to do is to study the effect that Medicaid had on people's health. This is like the gold standard of randomized controlled trials, what's going on in Oregon. What did they find? Medicaid really had no effect on people's health. People said they were healthier, they felt healthier, but that's because they felt healthier before they even got onto the Medicaid program. What does Medicaid expansion mean for everyone else? I think it will mean fewer and fewer people, more and more people competing for fewer and fewer doctor's appointments. South Carolina has a primary care shortage in all of your 46 counties. I think nearly 1 in 5 South Carolina doctors are over the age of 60. So bottom line, Medicaid really has a very poor track record of improving patient health, and putting more people onto the program, I think, will just make those problems worse. So finally, what has happened in other states? We have the experience of all of these other states who have decided to expand Medicaid to the Obamacare Medicaid expansion population, which are, again, childless adults without disability. And here are the states that we studied. You can see that they're a mix of small states and big states, red states and blue states, and I think what they all have in common is the fact that their experiences can tell us how the Obamacare Medicaid expansion will grow. Let's run through a few of them. On average, what has happened in these states that have decided to expand Obamacare even prior to the law's passage? Well, we hear that expansion will reduce what's called charity care. So what charity care means is it's the tab left by the uninsured who can't pay their hospital bills. That's basically what charity care is. What we found in states that have expanded Medicaid, it did not reduce charity care, and in some cases, it even made it worse. We hear that Medicaid expansion will reduce the so-called hidden tax that Medicaid passes on to people with private insurance. The logic there is that the government doesn't pay doctors and hospitals enough to treat a Medicaid patient, so doctors and hospitals pass those costs on to those of us with private insurance. But what we found in states that have expanded Medicaid, it did not reduce the hidden tax, and in some cases made it worse. We hear that expansion will be fairly inexpensive, especially with all this federal funding, but what we found is that in many states dramatically underestimated enrollment and underestimated costs. And finally, we hear we need to expand Medicaid so that we can solve the problem of the uninsured. But what we found is that after some states expanded Medicaid, the percentage of uninsured really didn't change at all. Let's talk about the state of Maine. So about 10 years ago, Maine passed a Medicaid expansion to the Obamacare expansion population, so childless adults without disability. You hear these arguments in South Carolina. The expansion was supposed to reduce charity care and reduce the number of uninsured. Here's what happened. Charity care, those are the blue bars, dropped for 1 year and then increased fourfold. They estimated about 11,000 people would sign up, that's the black line, out of about 14,000 people they thought were eligible, which is the green line. But in just over a year, as you can see with this red line, twice the number of people enrolled in Maine's Medicaid expansion. So what happened? When Maine expanded Medicaid, they underestimated enrollment and cost, and it did not reduce charity care. Arizona faced similar problems. According to the Arizona Hospital Association, you remember that the hospital associations are the ones pushing for the Medicaid expansion. After Arizona expanded Medicaid, their charity care went up at an average of about 9% per year. The Lewin Group also estimated that after Arizona's Medicaid expansion, the hidden tax from Medicaid actually was worse than the unpaid bills from the uninsured. Some more data from Arizona. As I mentioned, in the year 2000, Arizona actually passed a ballot initiative to expand Medicaid to everyone earning up to 100% of the federal poverty level. And what happened in Arizona, I think, is another case of Medicaid expansion signing up way more people than they even thought were eligible. This chart will show how many low-income parents enrolled in Arizona's Medicaid program. This dashed line is a projection of how many parents they thought would enroll. Here's who they thought was eligible, and here's how many folks actually enrolled. It was double than what they projected. What happened is that most people in the Medicaid expansion population dropped their private health insurance to get on Medicaid, and that's what us health nerds call crowd out. So when you hear crowd out, that's what that is. Here's a look at Arizona and the number of childless adults that went onto the Medicaid program. This dashed line shows how many people they thought would sign up. This is how many people they thought were eligible, and that's who actually signed up, about triple than what they originally projected. You can see that big drop-off there at the end, so it went up to about 220,000 and dropped off to about 86,000. Why did that happen? Well, Tony talked about this before. You know, the federal government can print money, states can't. What happened is that Arizona expanded its Medicaid program so big, they had to cap enrollment. They stopped heart and lung transplants for people on the Medicaid program in order to cover childless adults without disability. I mentioned earlier that some studies like Milliman and others talk about savings from Medicaid expansion, but again, those studies assume that the expansion population is much cheaper to cover than they actually are. Here's a look at Delaware, Oregon, and Vermont and what it costs them to cover low-income parents that are currently in the Medicaid program versus the childless adults coming into the program because of expansion. Remember, the Milliman report here in South Carolina said that they were going to be the same exact cost to cover, $4,600 for low-income parents, $4,600 for childless adults. What we found in these three states is that childless adults cost almost twice as much to cover as low-income parents. Again, that Mathematica study commissioned by Kathleen Sebelius shows that the people coming into the Medicaid program are older. They're more likely to include men. They're more likely to be disabled. Vermont and D.C. also had similar results, but to a lesser extent because they capped Medicaid expansion benefits. I think this is the most interesting part, and this talks about, does Medicaid expansion really address the percentage of uninsured? And of the states we studied, we found that for many of them, they had no change in the uninsured. Here's a look at Maine. The percentage of Maine's uninsured, which is the black bar at the top, has remained unchanged since their Medicaid expansion. What happened is that more people dropped their own health insurance coverage, more people dropped their own health insurance coverage and more people got on Medicaid. You can see that Medicaid increased by the same percentage amount than folks that dropped their private health insurance coverage. It's the same in Arizona. You can see that before and after their Medicaid program, the percentage of uninsured really remained unchanged. More people dropped their private health insurance coverage, more people got on Medicaid. We looked at Delaware and Oregon also. I didn't have time to make charts for those. After Delaware and Oregon expanded their Medicaid programs, their percentage of uninsured really didn't change. To be fair, Oklahoma expanded Medicaid, and they did have a drop in the uninsured rate, only about 1.9% 9 years into the program. And interestingly, we looked at Michigan and Utah, and they both expanded Medicaid to childless adults. After Michigan and Utah expanded Medicaid, their percentage of the uninsured actually went up. So, to recap, I think there are so many reasons to be cautious about Medicaid expansion. We don't know how much it's going to cost. It's already an expensive program to begin with. I often call it the Pac-Man of state budgets. It just eats up everything else. We know that it's very likely that the federal government will shift more Medicaid expansion cost over onto the states. We know that Medicaid has more problems with access to care and health outcomes. And finally, we have this experience of states that has told a cautionary tale. Here are some ideas for reform. I kind of feel funny talking about reform with Tony here because it's kind of like telling Michael Jordan how to improve his jump shot. You just don't do that. But here are some ideas that I'd be happy to chat about in Q&A if you would like. We have the experience of Medicaid reform in the state of Louisiana with Bayou Health, with Florida's Medicaid reform, with Kansas and CanCare. They're doing some really innovative things. For instance, Kansas is starting a Medicaid to Work program that diverts the savings from Medicaid reform into a little pot of money where they can kind of pluck people out of government dependence before they even start. So they use the savings from Medicaid reform to help low-income young adults find jobs with employer-based coverage. Some really promising stuff. I want to end with this, and I think when we talk about Medicaid in general, we know that it's about the patients. I talk about Medicaid expansion, Medicaid reform. We saw what happened in Arizona, where when you expand Medicaid so much, you end up hurting the people who really need to be on the program. And I think the goal of any Medicaid conversation is really to make patients happier and healthier. It's to move patients from sickness to health to a better life and off of the Medicaid program entirely. The reason why I do what I do is because of people like my friend Moyes Brutus, who you see here on the slide. About 3 years ago, Moyes was coming home from a chemistry study group, and he was on his motorcycle, and he completely wiped out in like the Everglades of Florida or near the Everglades of Florida. And this kid was so mangled but had the wherewithal to use the GPS on his cell phone to have the ambulance locate him. I mean, that's the peace of mind that Moyes had. He became a triple amputee. Before the accident, Moyes had never been on Medicaid before. He was working as an assistant manager in a car dealership. But of course, after the crash, Moyes could no longer work or afford health insurance coverage for himself. So after the crash, Moyes got a letter in the mail saying that he was going to be enrolled in a privately run Medicaid plan. But Moyes said, you know what? I'm just not going to deal with it. I'm stuck in that old government-run Medicaid system. I wanted a new hand. They denied that. I can't get in to see a doctor. And the only thing that the old Medicaid system will do for me is just give me a bunch of drugs to help me sleep. That's all that he could do. So finally, Moyes' mom got a letter in the mail. He was enrolled in the Medicaid Reform. And he said that I wasn't going to deal with that either. And the mom said, keep calling Moyes. He needs to be helped. It's one thing for me to tell you how Medicaid reform affected Moyes' life, but it's another for me to show you with Moyes' own words. So if we can cue the video, that would be great.
Life growing up was pretty good. What I can remember was, what every child would imagine their child to be like. Until October 11, 2010. I was in a really bad motorcycle accident where I had a less than a 1% chance of survival. I woke up from a coma 3 days later, looked down, and I couldn't believe it. My legs were gone. My name is Moyes Brutus, and I'm a triple amputee. First thing I said was, oh my God, my life is over. For about 6 months, I just stayed in a dark room and never left. At my lowest point, I was about 76 pounds. And my mom, she lost all hope. To me, I had two choices. Either stay in clinical depression for the rest of my life or go out there and be everything I can be. I made the decision to not let this accident define who I would become. At that time, I also met Catherine Martinez from Obamacare, who went out of her way to give me everything I needed. Catherine and I, with the help of providers, were able to give me to amputee support groups, which helped my morale a lot. Just around the time I got in touch with Catherine, another big change happened. I got Dexter, my best buddy in the whole world. When I got him, we were out around the block every afternoon when the sun went down, and that wasn't starting at all. I also started doing outpatient rehab, and that's when I started venturing out of my comfort zone. One day at therapy, one of my therapists decided to put me on a stationary bed. I remember the whole room went quiet because everybody thought I wasn't going to be able to do it. I work out 5 times a week. I cycle about 100 miles a week. I go to school, and I'm totally independent. My life today is amazing. I'm currently training for the 2016 Paralympic cycling team. When I'm on the bike, I feel like the wind. I feel free. I feel like I have no disability. I never thought that going through something so traumatic would lead to so many good things. Whenever I had any doubts, I've always had the support of many who push me through it. Someone said that the brightest lights come from the darkest places, and it is so true. This past year, I learned so many lessons. Even though I have so much more road to travel, this chapter of me getting back on my feet is almost done. I feel like my foundation is set for me to accomplish anything I want to.
Isn't that an amazing story? When we talk about Medicaid and Medicaid expansion, I think of Moyes because they gave him prosthetics that would break every couple of months. That's the only thing Medicaid could afford. And when we expand Medicaid to people who could really do for themselves, you end up hurting people like Moyes. So I think Moyes not only shows the impact that Medicaid expansion will have on the safety net, the people that need it the most, but also Moyes shows the power of Medicaid reform. As you can see, Moyes is walking. He became the first patient in Florida to get a bionic hand. He will graduate with his associate's degree next year. He is currently training for the 2016 Paralympic team, and his mom is really upset because she's the one that has to walk Dexter when Moyes is away. But Moyes is the reason why we're here today. There are so many patients like Moyes in Florida and South Carolina who need our help, who need us to strengthen the Medicaid safety net rather than expand it. So with that, thank you.